They, well, women who are in poverty don't get access to equitable health care at all. There is a less likelihood that their children are going to, be able to be fed adequately. One of the on many women are like over 25,000 South Carolinian women are on Women, Infants, and Children, which is the WIC program that's trying to provide, healthy foods for growing children. But the more that you have like a restricted access, meaning you may or may not be able to qualify for healthcare. I know that the state provides a lot of women who have children with reproductive health, but if anything else is wrong, you're not covered. So you get sick and you can't go to the hospital or the doctor. Your child gets sick, he can't go to the hospital or the doctor. It becomes, and then there's a cap. So after a while, we run out of federal dollars to put people on these type of assistance, and they get put on a waiting list. That's just the reality. And, there are certain circumstances that bump people off the list, but there's plenty of people who sit on the list for 2-3 years waiting to get medical assistance because of the fact that we as a state do not want to expand Medicaid. And it cripples a lot of other things outside of single parents, like our hospitals. But in terms of a single working person who has a dependent, is much less likely to go to the doctor in the hospital, like very much less likely. And that means that health issues can exacerbate. It also affects the mental health and emotional health of mothers, and a lot of time and energy is spent talking about every other types of health other than the mental health of mothers and parents, single parents, and a lot of them suffer with depression. A lot of them have undiagnosed mental, issues that they cannot afford to get seen about. So again, it compounds itself, and it becomes almost something that feels unsurmountable. But I think that there are things that we can do in this state to make it easier to be a single parent.
What would some of those things be?
Expand Medicaid, expand Medicaid, raise the minimum wage, really have a very serious discussion about creating more child care facilities that are licensed, accepting ABC voucher at more of these child care facilities, and making ABC voucher available to all single parents who are eligible. Those are the big things that I think would make a huge difference.